If you are new here, I am pregnant for the first time and I just finished my second trimester. The baby is going to be here very soon. So I thought I'd give you an update on how the pregnancy is going. We also found out the sex of the baby, which I will be sharing. I'm Dr. Sam Ellis and I'm a board-certified dermatologist. I'm here to help you understand your skin and find skincare products that work for you. If you like this video, give it a thumbs up and subscribe to the channel. Out of the gate, the biggest difference between first and second trimester is you have energy. At least for me, I was dead to the world my first trimester and I tried to hold it together at work, but I would come home and almost just fall asleep immediately. So I just feel like myself again in the second trimester, which is huge. I would say around week 15 or 16 is when I started feeling good. That's when I had my energy back and when my nausea went away. However, my nausea was very shortly replaced with heartburn. Now, I'm not new to heartburn. I have been struggling with heartburn since I was a college student. So I actually don't feel like that's that much of a pregnancy symptom for me. That is just like a Sam Ellis deals with heartburn periodically issue. So I'm okay with it. It's not a big deal. One thing that's kind of weird about the second trimester is you hit this span of weeks where you're getting bigger for sure. Like you can see your belly getting bigger. You might be getting bigger in other places as well, but you are not visibly pregnant to like a stranger's eyes. And that's the point in my pregnancy where I felt the most self-conscious because I felt like my body was changing and I didn't feel like myself, but I also didn't look like pregnant. And I feel like once someone's pregnant, you can just go, oh, her body's changing because she's pregnant. But in that in-between phase, I just felt like my clothes didn't fit right and I didn't really feel super pregnant yet. And that in-between phase made me more self-conscious than I really anticipated. Now that I have a legit belly going on, I feel a lot more comfortable in my body and in my pregnancy. And that transition period between not being pregnant and being visibly and definitely pregnant was just a weird time for me. And I don't know, I just never heard anyone else talk about it. So I was like, am I the only one who feels this way? But it was a little bit odd. Also, I didn't feel like I could really attach myself to this baby and this pregnancy until I had the fetal anatomy scan at the 20-week mark. If you have not had a baby before, around the 20-week mark of your pregnancy, they do a full ultrasound scan of your baby, head to toe. They check the internal organs, make sure the heart has 4 chambers that are functioning properly, making sure the baby has 2 hands and 2 feet and the fingers and all those little things. Unfortunately, the 20-week anatomy scan is also where some people find out if their baby has a developmental anomaly. Other surprises can kind of come up at that scan. It's rare, of course, but it can happen. And so I think just based on my medical background and what I experienced through medical school and the rest of my training, there was part of me that was holding my breath until that scan happened. And once we found out that baby was growing according to how they should be and all of that, I was a little bit nervous. During my fetal anatomy scan, they did find a pregnancy complication, if you will. I have something called a velamentous cord insertion, which means that the baby's umbilical cord does not insert directly into the placenta as it should, but it's sort of off to the side. And in people who are having a single baby, this happens like 1% of the time. So I was just like, perfect, why me? But that's part of pregnancy. There are things that can happen that are unexpected. The hard part is that it does increase a lot of pregnancy risks in a lot of ways, but at the same time, those risks are still very, very rare. And as a mom-to-be, there's nothing I can do about it. So I know that that's there. They're going to be monitoring the baby more closely than they would in a normal pregnancy or a less high-risk pregnancy, but maybe it's just because I know it's out of my hands. I feel like I can just let it go and understand that this is something that I have to sit with through my pregnancy and that if any complications arise, I will address them as they come, but there's no reason to worry about it any other time because there's nothing I could be doing differently. On the topic of medical testing, I also had my glucose tolerance test, and that is a test that's done usually around like 24 to 28 weeks of pregnancy, and it's to assess whether or not you have developed gestational diabetes. For most people, you go into the lab, they make you drink 10 ounces of a drink that has 50 grams of sugar. So a very sweet beverage, and you have to drink it in under 5 minutes. And then you come back an hour later and they check your blood sugar and they want to make sure that your blood sugar stays within an appropriate range. And if your blood sugar is out of that range, you have to have an additional glucose tolerance test, usually the following week. And if it's within the range, then you're sort of cleared for not having gestational diabetes. When I had talked to people about this glucose tolerance test, they made it sound like it was the worst thing in the world. And I don't know myself it's just because I've drank a lot of sports drinks in my life, or I have a sweet tooth, or what it was, but drinking 10 ounces of something really sweet was not a problem for me. Mine was orange flavored. It sort of tastes like if you liquefied like an orange lifesaver and had to drink that, or if you had like a very sweet Sunny D, that's what it tastes like. My biggest recommendation would actually be to go in thirsty, because if you're thirsty, drinking 10 ounces of anything is a lot more palatable. If you go in and you're full, or you just drank a bunch of water, I feel like drinking a really kind of sickly sweet beverage might really put you off, but I thought it was fine. And I am happy to report that I passed my glucose tolerance test. I will say the physician in me really hates that it's considered a pass or fail type of test. I feel like that makes patients who don't pass the test feel like they legitimately failed something, or they're failing as a mom or being healthy for their baby. And that's not what this kind of screening exam is for. It's really just to make sure that you are going to be as healthy as you can be for your pregnancy, and that any interventions that need to be done can be made early to optimize baby's health. But I don't know, I feel like moms feel like failures if they fail their glucose tolerance test. So I wish they didn't use that verbiage. Outside of the medical screening tests and my body just sort of getting bigger everywhere, the only other thing I've noticed is my skin has continued to be dry, and that I started to get breakouts like on the back of my thighs and like a little bit on my tush, and that's just not something that I deal with very often. I was like, what is going on here? I've never had to treat body acne in myself, especially as an adult, but I did find one product that I think works amazingly well for body acne, and that is the Neutrogena Stubborn Acne AM treatment. It's just 2.5% benzoyl peroxide in a leave-on type of preparation. For whatever reason, I thought that worked amazingly well. I would put it on after a shower, and usually after like a week of consistent application, I would see the amount of breakouts significantly decrease. And then if I would stop doing it, the breakouts would kind of come back. So it was absolutely working. And for whatever reason, I was just like not in the mood to deal with a benzoyl peroxide wash. And so having a leave-on treatment that I could put on after the shower was working really well for me. And I will continue to use it throughout my pregnancy as I need to. I'm just at that point in my pregnancy where I think I do need to start investing in a few more maternity wear pieces. I think I got away with it for a very long time because I wear scrubs to work. So I didn't need a full maternity wardrobe, but I am at the point now where like nothing really fits very well. The maternity wear company Stork very kindly sent me some maternity basics. They make this long sleeve base layer that has this sort of deep scoop neck, and my husband was like, whoa, cleavage. But it's very fitted, but so comfortable, and I think it will just kind of grow with me throughout the pregnancy and also be perfect for postpartum. So I'm really glad to have a couple like good long sleeve shirts to wear that I can pair with leggings for a more casual look, and then once I finally take the plunge and buy maternity jeans, I will wear it with those as well. One more thing about maternity wear. The physician and the dermatologist in me highly recommends that you wear compression socks regularly during your pregnancy. And this really serves multiple purposes. One is to do some good preventative work in terms of forming spider veins and varicose veins on your legs. So if you look at some women, you'll see a lot of dilated blood vessels superficially on their legs. And I would say most women who come into my practice are not thrilled that they have these. And yes, some of that is genetic, but absolutely being in a state of pregnancy can provoke those types of vessels to form. So compression socks regularly can help prevent that. Also, you might notice that your legs start to swell more during pregnancy, and so it can help with leg and foot swelling, and then also calf and foot fatigue. So there's plenty of reasons to wear them. I wear them pretty much every day. Granted, I'm wearing scrubs, and that is an outfit that accommodates compression socks a little bit more, but any day that you're wearing long pants, put some compression socks on. There is a compression sock company called Pear that makes socks just for pregnant women, and they have enough pressure that they're doing good preventative work, but they also are easy enough to put on, and I've really liked their socks a lot. And then even before I was introduced to Pear, I wore Pro compression socks, and I still wear those a lot too, and I just think those are two great companies to look at if you're looking into buying compression socks. And now I will get off my compression sock soapbox. Some people have asked if I've started nesting yet, which I had to admit I actually did not know what that was, but it's kind of intuitive. It's like the urge to get your home space ready for the baby. And maybe I'm having that a little bit, but more than anything, I just want to throw everything away. Like I'm not nesting, I'm just like purging, because right now, like I don't have space to put a baby and all of the baby things. And now that I sat down and made a proper baby registry through the strong urging of my mother, I feel like I definitely need space because now things are starting to come. We've gotten a few baby gifts so far, little toys and things like that. I think the sweetest cutest thing was baby Bjorn that my boss got me, and my husband tried it on and I died. Like, my heart melted. He looked so good in an empty baby carrier. I can't even imagine what he's gonna look like when we have our little child in there. I had actually done a question on my Instagram stories asking people what they recommended for a baby registry. So I compiled that into a huge list, which I am going to put on my Instagram in the coming weeks. So keep an eye out for that if you want to know what was suggested for my registry. And I can also just like share what my registry has on it if you need ideas, because I got all the ideas from everyone and then I heavily vetted them. And as I wrap up this second trimester update, I think it's time for me to share the sex of our baby. We're having a boy. I'm so excited. I am over the moon. I grew up with two brothers. I know that they're really excited. My husband is thrilled. Of course, boy or girl, we were going to be so happy, but there's something about knowing the sex of the baby that makes it that much more real for me. And now you guys get to know too. Thank you so much for watching and joining me on this pregnancy journey. Hopefully these videos are helpful or interesting to you, or just give you a little glimpse into the life of a new pregnant lady. If you have anything that you think I absolutely need to buy for when the baby is here, put it in the comments below. Everyone can learn from those comments, so it's really helpful. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll see you next time.